Hi guys, today we're talking about canine blood glucose monitoring. If you have a dog with diabetes, you should be doing this on a regular basis. The purpose of this video is to empower you so that you know you can do this safely and easily. But before you try, make sure you talk to your vet first. I'm not a vet, I'm only sharing my personal experiences, but I'm trying to encourage you that you can do this safely and easily. So let me show you. This is Sassy. She's our 12-year-old Yorkshire Terrier. She has diabetes. We use the Rely On strips and meters to test her very easily and safely, and also very affordably. It takes about 50 cents for each test strip to use. This is the meter, this is the test strip, these are the alcohol swabs and the lancets that we use. And we actually put Sassy on a comfortable blanket. We shave her tail and we test on her tail. Because she's such a small dog, her lips or her ears to test with or her paws just wouldn't work for her. But her tail is another extremity that works very fine, and we get accurate readings with that. So you get your meter ready, and then you're going to sterilize everything, sterilize the lancet, sterilize the tail before you inject. Now, the reason why I have this video out here is so that you can do this safely and easily. And what I would ask you is, I talk to a lot of people that don't test their dog on a regular basis, and yet they still give insulin injections. We'll give a little poke right here. Sassy doesn't even react. As you can see, we do this all the time. We test her multiple times a day, and we always test her prior to any injections. We're getting a small drop of blood, and then we're going to use the test strip to monitor that. But if you're not testing your dog prior to giving an insulin injection, then I would wonder, how do you know how much insulin to give? Really, the insulin should be matched based on what their glucose needs are at the time. So if the dog has low blood sugar and you give an insulin injection and you didn't test to see where they were at, you could drive them into hypoglycemia. That can be even lower blood sugar, which is very dangerous. Here we go. We draw the blood sample up, and then we'll test where we're at. But if they have high blood sugar and you don't give enough insulin, they could also have damaging hyperglycemia or high blood sugar. Sassy right now is at 142. That's very good. We'd like her to be at 150 at all times outside of when she's eating, and within 2 hours of eating we want her to be below 180, 200. So Sassy's still with us. She's doing very well, and we're happy to say that we test her all the time and she's very comfortable with it. Again, I want to show you that you can do this easily and safely. You can then match your insulin to the glucose, so you have a better chance of making sure your dog stays healthy and stays with you for a long period of time. If you want to talk further, email me and I'll be happy to give you, further encouragement and tell you what we do as well too. God bless you.